I'm going to be talking about a subject that I'm really passionate about, which is donor preservation. Unfortunately, I think it's a topic that no one cares about, no one talks about. What you're seeing on the internet today is really bravado. A lot of people talking about how many grafts they can move. They talk about a 3,000 graft case, a 4,000 graft case, a 6,000 graft case. First of all, I truly question if that's the number they're getting, because to me it's an insane number. But what's more important that people not talk about is what are they preserving? Because first of all, I see probably every week to every month, somewhere in that range, a case of over-harvesting where people are just taking way too much of the donor away and they're getting a moth-eaten appearance and the whole backside is gone. And you know how you fix that? You can't. It's gone. It's destroyed. And with the current black market situation, with the epicenter being right now in Turkey, there are no doctors doing it. It's just an unlicensed technician who's doing illegal work. Basically there's no supervision anymore. And the harvesting is done where they're just taking the whole backside and erasing it, and there's nothing left. And then they compound that with a horrible frontal result that you can't fix either. I just ran my course, my 15th annual hair course in St. Louis, where the hairline is way too low. The grafts are insane. It looks unnatural, but they don't talk about donor preservation, which is how to preserve the donor from over-harvesting and other problems. Now, here's what's interesting. Is over-harvesting the only thing I worry about? No, because you could have a great result, but you still could have risk. And the reason is you took 3,500 grafts out when you really only needed 1,500 grafts. And what happens is that donor may still look good, but there are no grafts to take for the future. So what are the problems of doing that? So let's take a 30-year-old. Okay, let's actually take a 22-year-old. I had a gentleman that posted a comment on my Don't Be a Turkey and Go to Turkey video and says, look, you got to do your research. I went to Turkey. I'm 22 years old. They did a great job for me. First of all, I don't even know if they did a good job because I need to see what he defines as a good job. When I see that photo, I will probably say, no, that's not a good job. Or maybe I'll say it's a good job. The problem is inherently problematic that he's a 22-year-old, because most likely a 22-year-old wants a very low hairline that looks great for about 5 years, but then it becomes a disaster. But also, I rarely operate on a 22-year-old. I don't even remember the last time I've ever done that. I may have never even done that. 22-year-olds are really young to get a transplant. And a great example is if you think of Bruce Willis, when he was doing moonlighting in the 80s, he had a Norwood 3 pattern, which means sort of a high peak zone, but pretty good frontal zone. I'm a Norwood 2 with a maybe going to a 3, and there's a little bit of a high recession on the sides. But when he's now in his, I think, 60s or maybe 70, he is a Norwood 7 plus. Now the end of the highest number is a Norwood 7. So when I say 7 plus, means instead of just having a tiny horseshoe, he's got a microscopic horseshoe, and he's got almost all of that hair gone. It's like there's no donor left. There's not even anything. So if he had a transplant, especially with FUE, harvesting a big zone, those grafts would have all died. He would have had scarring on the backside exposed. He would have had maybe certain zones kept that would have been off. There's so little prediction. So when you're dealing with a super young person, and this person said he's on dutasteride, great. Dutasteride is great, but it's like a speeding train going forward. The hair loss is like a speeding train going forward. You can put Superman to slow it down, but it's still moving forward. And so you got to be super, super careful when you're dealing with a younger patient. I don't like to operate on people younger than 30 if I can avoid it, and I prefer 40. I love 50, and I'm in love with 60. So I'm not saying I don't operate on a 30-year-old. I'm not saying I don't operate on someone younger than 30. But when we have an issue, we got to be very careful with future problems. So you can't, I always say it's a donor bank that you steal from that you can never replenish. It's almost like having a savings account that I can take from, but I never replenish the savings account. And that's the donor area. And the graph that I always say is like a supply and demand curve, where that supply keeps on going down and the demand keeps on going up. In other words, your donor supply keeps on going down because your hair loss can encroach on it. In addition to that, you may steal from it to do transplants, and your demand only gets worse over time. And so that you're dealing with this horrible situation. What you don't want is the curves to cross. You want your supply to go down and your demand to go up, but hopefully those points never cross. When they cross, is when you have a non-fixable situation, because FUE is not scarless. You can't get out of that situation. When you shave the scalp, you actually have you have dots, visible dots, and this is where the problem is right now, is that you can't escape from it. So you always want to leave some in your donor bank. The other thing is that people don't understand, and this is a concept that's a little more complicated, but I think it's worth discussing. It's still part of donor preservation. So I always say it's not what you take, but what you keep. So if you want a great result, I'm going to get you a great result that looks natural, that age well for you, but you want to preserve what's back there. So another concept, another part of donor preservation is safe donor area. So what is the definition of safe donor area, or SDA for short? So the original definition by Walter Unger back in the, I think, 80s or 70s of safe donor area, or SDA, was like a Norwood 7. So he found that about 20% of men go to full Norwood 7, which is the baldness that exists. So Norwood 7 is this narrow strip in the back, as I mentioned, like a horseshoe. And if you say, I don't see people with horseshoes anymore because they all shave it off, right? So, but if they didn't shave it, the worst case, they would have a horseshoe in the backside. So he defined that as the SDA because if you harvest in that middle zone, that scar doesn't show up, those grafts don't fall out, and you have lifelong preservation. Well, the problem is that was during the era of FUT or strip, which I still perform a lot of because I think there's still an amazing role for it, especially in advanced baldness cases, as I'm alluding to now. But when you're looking at that back zone, that SDA does not fly with FUE. You cannot do the traditional SDA for FUE. And the reason is if I try to harvest with FUE on a small little donor area, you get two problems. The first, there's simply not enough grafts. If you try to take all those grafts, the whole backside's gonna be gone. You're gonna get that moth-eaten appearance. You simply don't have enough area to cover. You need a much larger area on the backside. You need a wall of hair to take from for FUE. Otherwise, you're gonna get an over-harvested issue. The other problem is if that area is very narrow, okay, and you are taking, I mean, that's probably over narrow. If it's that narrow, I wouldn't be doing a strip either. But let's say it's that narrow on the backside, okay? If you take a strip, you have a room for that to fade into the zone. If you do FUE, I harvest right to the edge because I almost have no room to take from. Then I'm at the border of what's safe because let's say that hair loss advances downwards. Once that hair loss advances downwards, then those grafts fall out, the scar is visible, the dots, the FUE dots are visible, so that's why you don't want to harvest right to the edge of an area. So where do I have fear? I have fear when I'm dealing with a very young patient under 30, and I have fear when I'm looking at the size of the donor area of what I have to work with. When they're starting to get crown baldness, especially a younger patient, that is when that real risk heightens. Because FUE, you have to harvest very high. You can't harvest narrow. And so when I'm harvesting very wide, then I have risk because it's getting closer to the zone where that crown could dip in. When that crown looks solid, I can do FUE, I can do strip, anything. I feel very, very confident. When that crown starts to recede, I start getting worried. Now, what are some exceptions where FUE really does great when I'm dealing with a crown expansion? When the crown is sitting on the horizontal scalp, in other words, very, very high up, and there's a wall of hair that goes all the way down to the nape of the neck, and there's the nape of the neck being the bottom of the area. That's an area, if there's no retrograde hair loss, which means hair loss is not going back up, then that zone that's way down low, FUE is amazing for. You can't take that with a strip because you're going to have a bad scar back there. And my scars with FUT heal very, very well. But with FUE, you're able to pull much lower than you can with a strip, that you're going to not be able to capture those grafts with the FUT. But you can capture them with FUE. So you can go much lower down there and take those hairs that are precious, that are beautiful, and so long as there's no retrograde loss, and that's what the doctor has judgment experience. I've been in practice over 20 years, can look at that and make a decision what's safe. Ultimately, if a doctor is unethical and a doctor doesn't care about you and wants to sell you a procedure, that's where a problem is. And that's what another problem is when you're meeting with salesmen just selling you something because they need to meet a quota, they need to make money on you. That's a real problem. I really turn away a ton of patients because I feel it's unethical in so many patients that they should not have a transplant, because once you get a transplant, you cannot get out of it. You need to do more transplants. So I take that decision to go forward with a transplant very, very seriously. But anyways, let's get back to the subject. So when I have a very good wall of hair because the crown loss is very high and they've got this beautiful nape of neck problem, nape of neck, beautiful hairs that sit below what's called the supranuchal ridge. A nuchal ridge is that bump you feel back there. If you go and it goes way down low and they have no signs of retrograde, especially if they're older, maybe 45, then I feel, hey, you know what? I can take that and do a great job. To be honest with you, sometimes I do FUT and FUE for maximal prevention of over-harvesting and to tap all of these resources, but I don't always do that. It's in fact, it's not that common I do that. There's a special situation. I have two coming up that I have that are absolutely special situation where I'm going to do a combination. And to be honest with you, I see a real problem also with, I see these people with Norwood 6-7s, they're doing a strip and FUE and they're taking that FUE right to the edge of the border on a 7. That's particularly very dangerous and because of all the reasons I've enumerated. So I don't even charge per graft anymore because I think that is people are just trying to boast large graft numbers. And I always try to tell my patients, you know, let's say I move 1,000 3-hair grafts, okay? So you remember hairs grow in follicular units, so they grow in 1, 2, and 3-hair clusters. Let's say I move a lot of 3 hairs. You're lucky you're born with a lot of 3-hair grafts, and I can move 1,000 of those. That's how many hairs is that total? Because hair count is really what makes a difference. So 1,000 times 3 is 3,000, right? Let's say I move 2,000 grafts, but they're all 1 hairs. Okay, that's an unlikely situation that'll be that extreme. I'm just trying to use some math to have you understand. So let's say I move 2,000 grafts, but they're all 1-hair grafts, okay? That means you have 2,000 hairs. Well, if I move, which would you rather have? 3,000 hairs or 2,000 hairs? Of course 3,000 hairs. But which would you rather have, 2,000 grafts or 1,000 grafts? Well, of course you want 2,000 grafts. But ultimately, which one wins? Is it the 2,000 grafts or the 3,000 hairs? The thing that wins is the 3,000 hairs, not the 2,000 grafts, because the 2,000 grafts only is giving you 2,000 hairs, whereas the 1,000 grafts are giving me 3,000 hairs, because the net number of hairs is really where the money is, okay? So these graft counts that people are pronouncing on internet of, hey, I'm doing a giga session with these number of grafts, the reason I have a serious problem with it, first, I don't think they're all telling the truth of how many grafts they're putting in or taking out. The second is that it's driving people toward over-harvesting and destroying areas. Third is, I don't think the doctor is even in control of it, so they don't even know how to harvest. And fourth is, down the line, there could be serious problems, even if there's not over-harvesting today. So what I do on my own donor harvesting, and when I'm doing my donor harvesting, what I'm thinking about constantly is this harvest going to be a problem? And so when I teach FUE fundamentals in my course, I look at, if I take a graft out here, is there a graft above it to cover that hole? Is there, and that's how difficult the process of harvesting of FUE is. If I take too many 3-hair grafts to get better yield on the result, will I over-harvest this area and leave nothing for the next session? These are very difficult situations, so it's an incredibly intellectual exercise when I'm harvesting that requires constant thinking. I don't talk during harvesting. I'm constantly assessing and reassessing. Now, I've done this so many years that I have an intuitive movement that I'm not going, I should take one. No, I'm going like about this speed, boom, 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 boom. But my brain is constantly recalculating and thinking about it. So I'm looking at safety. And so the take-home lesson that I want you to get from this very long, hopefully not too digressive video is when you're seeing a doctor, don't ask how many grafts. I mean, you can, but ultimately they don't know. They really don't know. What you need to focus on, are you finding a doctor who cares about you ethically to do the right thing? Or is the doctor really the one doing it? Are you having some random person doing it? And are you really understanding donor preservation issues? When a doctor says, look, I can't do the surgery for you, don't go down the street, because going down the street, they don't know. They absolutely don't know. And if you can, and the other thing during consultations, what are you smelling? Are you smelling greed? Are you smelling the consultation needs to close and you're getting a 10% discount at the end? Hurry up and sign up with me. These are truly problematic, and I would really encourage you to really understand that donor preservation are the 2 words that are always in my mind during a consultation, during a surgery, and anytime I see you thereafter.